Hi, I'm Steve White. Today we're going to talk about what questions to ask your doctor. Now, it's not just what you ask your doctor, but it's how you ask your doctor, okay? Now, I never claim to be an expert, but I am pretty experienced in this, and I hear from patients all the time, and it's really important how you present to your doctor. One of the first questions you want to ask your doctor when you go in and sit down with your doctor is, how does he want questions? Okay, now remember, you're trying to do whatever you can to support your doctor in his efforts to get rid of your cancer. So you don't go in and confront your doctor with things. You don't go in and act like you know more than he does, or somebody from somewhere else told you something. You want to go in and you want to make him the champion that he is. And by doing that, you need to enable him by asking how he wants to work with you. So the first thing is, how does he want questions? Okay, now there's some doctors that want it in an email form because they email all the time, and there's some doctors that like that. There's other doctors that don't email at all. They may say, well, I'd just like you to ask them like you're asking right now. Some may say, well, you can talk to my #1 nurse. She always has great answers and she's a lot easier to access. Whatever his routine is, the only way you're gonna know is ask him. Okay, so start off your first meetings with your doctor by just saying, doctor, how would you like me to be able to ask questions? I'm sure I'm gonna have a lot of questions. Now, the second thing is that you want your teammate involved, okay? Now, remember when we talk about teammates, teammate may be different people. It might be a husband or a wife, might be a friend, but it's important when you go in these meetings that you have a teammate. You have somebody with you who's helping you understand what they're saying, because it's just true. You get to a point sometimes where they say something and all of a sudden you're going, wow, what does that mean? And you can't even hear them talk, okay? And don't feel bad about that, because it happens to all of us at sometimes. Some meetings and some situations in our life. And right now you're filled with a lot of stress because this is a real tough situation to deal with. But the best way to deal with it is to make sure you're organized. So have your teammate there. Now, when your teammate's there, this sounds really simple, but write things down. Now, I've had patients before where you're starting to write and you can't even remember what you're writing, okay? Because it can, again, happen to you. Have your teammate take notes. Have them be almost like your assistant, and them take the notes of what the doctor's saying. And here's something else. When you have a doctor in front of you, his time is very special, but you'll find most doctors are really open to somebody who's organized because they know it saves them time later. So don't feel bad when you say, excuse me, doc, can you slow down a little bit? How did you spell that? And have them spell the individual drugs. Sometimes drugs will sound very much similar to another drug, or something they say you don't quite understand what they said, because you're going to want to look it up later, or you're going to want to think about it later. You can probably come back to ourgame.com and ask a coach about it, and we can help you understand what it is. But you can't do that if you don't start out with a good plan. And the good plan in a meeting with a doctor, when you're asking questions, is to be organized enough to take notes. Have your teammate take notes. If you are going by yourself, okay, you're going to have to take notes. Just say, can you go over that again, doctor? How do you spell it? And you'll find doctors to be very, very helpful in slowing down when they know you care about yourself enough to take notes, okay? The other thing is that I like to say, after the appointment, huddle up, okay? Yeah, I'm an old football player. You're gonna get football terminology, but all I'm saying is that when the meeting's over with the doctor, you go home, you go get a cup of coffee, you're with your teammate, or maybe there's other people in your family or other people on your team that you want to talk to. Huddle up. Sit down and say, this is what he said. This is how I felt. I don't understand this. And that's where you can come to ourhomegame.com and you can ask a coach, ask other people that have the same problem that you have. Go to the forums. Look at the information on the site. Look at other videos like this video right now that might answer that question. But start off by huddling up. Now, if you are all alone, you can huddle up with us. Come online, chat with other people, say this, I just got back from my first meeting with my doctor, had some questions. But take time to be organized before the meeting with your doctors, to have your questions, have your paper ready, have your pencil ready, have some of the questions outlined inside your head of what you're gonna do, and then make sure that you write them down, and afterwards you huddle up. The next important issue is we get in there, and because this doctor is brilliant, he's went to school for years, his nurse is smart, they deal with cancer all the time, they deal with chemotherapy all the time, they'll run into something real quick. They're not trying to blow by you, they're not trying to to disrespect you, it's okay to tell them to slow down, okay, and ask the question again. But also remember this, there is no stupid question. And a good doctor knows that because, see, you can ask a question that even to you doesn't make a lot of sense, but the doctor knows that this is a process your brain's going through to understand what's happening. And sometimes you ask a question and they may answer it real brief and quick, and you might feel like, well, that was a stupid question. They don't feel that way. They just have a lot on their mind as well. So remember, there is no stupid question. Okay, the next thing I want you to understand is that anytime you're going through, this is what I love about traditional and expert doctors that you're dealing with, is there is a lot of research. They're not doing anything to you that hasn't been researched for years and years. So if they have a certain type of chemotherapy they're going to use, a little additional treatment on the side, maybe something to get your platelet level back up, whatever it is, there's a real important thing. Ask for the printed materials. Many times the doctor's office will just turn around and say, yeah, here's a whole pamphlet on that one issue I just brought up. So anytime they say something, you can say, is there any printed materials I can look at? And lots of times they have that right there for you. Then also remember, you can come back to ourhomegame.com. The same thing, you can ask the same question, and the coaches are really good at pulling research from the Mayo Clinic or New England Journal of Medicine or different places in helping you with that area. But ask for printed materials from your doctor and the nurse and the front office. It helps. Okay, another simple question you want to ask the doctor right from the first meeting, and you'll think this is almost funny that you have to ask it, but just do. And that is, how do you get a hold of them on weekends or in the evenings? Okay, they have a preferred method. Sometimes they have partners and one's always on call. Sometimes they have a certain number that'll call, that'll beep them. Whatever it is, they'll have a method that you can use. So ask, because if you don't ask now, there's going to come that weekend or that evening, you're going to say, geez, what do we do? And your only choice is going to be the emergency room. And emergency rooms are great, fantastic doctors there, but you're going to find it uncomfortable if you have to wait a long, long time. Even if the doctor wants you to go to the emergency room, he'll call ahead. His nurse will call ahead and they'll make some arrangements for you that'll speed up that process. So always ask, what is the number that I can get a hold of you on weekends or in the evenings? Okay, this goes under the questions to ask a doctor, but it's also the things that you should be noticing and collecting when you're at a doctor's office, okay? You go in, now listen, this can be difficult sometimes, but it's up to you. You're in control of your life, okay? You're in control of your team. So you have to be positive. You'll walk in sometimes and they've had a bad day. They've had some patient who just ripped them and ripped them. The front desk person just got ripped by somebody because they lost their chart or whatever it is. You do not let these things faze you. You've got to go in and be positive. They need to start seeing, when they see your face, they go, oh, I'm just glad they're here. That's the feeling they should start to get. And I don't care if it's the front desk, I don't care if it's the volunteer, if it's the janitor. Start making notes of what their names are. When you walk in and say, hey, John, how are you doing today? Guess what? He's going to try to help you out. You say, hey, Jesse, how's the daughter? Whatever it is. Start learning the staff of where you're going to go. This is your team, okay? The doctors, the nurses, but even the front desk person, the volunteer are some of the most special people you'll ever meet. Take time to meet them. Take time to get to know them, okay? So ask, when you go to the doctor, ask their names. See their name tags. Find out who they are. It will really help you in the long run because everybody's happier when you know who they are. Next, you get down to the chemo questions, okay? I even keep notes on that because you want to make sure you ask them all. And again, slow down and have them answer. First of all, you're going to ask, okay, what kind of cancer do I have? And they're going to say what kind of cancer you have. You're going to ask how to spell it. You're going to write it down. You're going to write, okay, they'll say, or they may not say, what stage of cancer do you have? Ask, is it stage 1, stage 2, stage 3, stage 4? And what does that stage mean? Ask so you'll know. And some doctors, it's hard to tell somebody they're stage 4. And sometimes they'll kind of brush by it. But you know what? What we want to do is we want to understand where we're at. If you understand the place that we're starting from, then we know what we got to face and we know how to do our best to overcome it. And we can't have a victory if we don't know where we're starting. Okay, so ask. The next question that you need to ask is, Why do I need chemotherapy? Well, it might seem obvious, and doctor might say, well, because I said so. You might get answers like that. But slow down and say, no, really, honestly, why do I need chemotherapy? What is it going to do? What is the benefit of it? Okay? Or maybe what is the goal of the chemotherapy? Because there is different goals, and you'll see that on some other videos. It might be to cure it. It might be to hold it at bay. It might be to reduce pain. It might be all kinds of different reasons. So make sure you ask. So what is the goal? Why am I taking the chemotherapy? Then you want to ask, and this is an important one, what are the risks? Okay? Depending on where you are in your health and what's going on and other things that are happening, maybe coming out of a surgery, other things that are going on, you need to know what the risk is, okay? And doctors are very good at explaining those risks. So again, take time, slow down, and ask, what are the risks? You want to ask, are there other ways to treat this cancer? Are there other options? Okay, he's explained now what chemotherapy is and why you're taking chemotherapy, but are there other options? You need to understand. Most doctors will answer all these things. Remember, I'm not the expert. I'm not the expert. The doctor is the expert. Okay, he probably will go through all these, but have these written down so you can ask in case he forgets or because you didn't hear him. This sounds like a repetitive question, but what is the standard practice, standard care for this kind of cancer? Because you might find out that this will help him even clarify what he's saying. I'm putting you on chemo because I think we got a really good chance to just kick this cancer's tail. I want to be aggressive with this cancer because you're really healthy, and I think that we can be aggressive right now, and it's going to stop some pain in some other situations later. But understand what the standard is and what he's doing for you, and is there any difference? Another question, which is a question that gets left off sometimes, but ask, are there any clinical trials? You can watch the video that we have that will explain what a clinical trial is, but ask, are there any clinical trials? Sometimes your doctor will say, yes, there is. There's 2 or 3 that you might qualify for, and we'll look into that. But you never know if you don't ask.